We have seen more cases of flu, especially. Regarding COVID, we have pretty much the same amount as we had last year. But this year we have a bit of a surge in flu, especially, and RSV. They're all respiratory viruses, so they are, essentially they get treated at the same way. Viral infection will not benefit from any antibiotics, so they give us similar symptoms, so like cold symptoms, body aches, feeling tired, cough, and all those, they should be treated as painkillers, decongestant, loads of fluids, and taking care. So they are similar. We cannot really differentiate from the symptoms.
Have they been particularly bad this year? And if so, why?
I wouldn't say that they've been particularly bad. We see that every year. I think that this year we had more cases coming, and it might be a combination of course, everyone gathering has before COVID, mask not being used in generally. We have introduced the mask again in the hospital, in the health center, mainly to protect the most vulnerable, because we've seen this increase in numbers, and doing that we have reduced the amount of admission and outbreak in the ward, which has been very good. But also we've seen that the vaccination for flu has gone a bit down this year. So that unfortunately impact on the numbers of infection. I know that we're going to have COVID vaccination roughly at the end of the month. And when we're going to offer COVID vaccination, we're going to offer flu vaccination at the same time. But even now, patients, if they want to be vaccinated for flu, they can contact the health center and we can do the flu vaccination for them.
And who is eligible for the flu vaccine?
Well, especially over 65 and patients that have any chronic health issues like diabetes, asthma, bronchitis. But if anyone is, worried and they might want to know more, they can phone 111 or they can take an appointment. We can discuss.
Now, if everyone who has a bad cold or the flu descended upon you in the flu clinic, you'd have quite a problem on your hands. So how do you manage the surge in cases around about this time of the year, and what advice would you give people at home?
We have increased the amount of flu clinics specifically, so there are more doctors or more appointments, but unfortunately we will never be able to meet the demand if everyone needs to be seen. I think that especially for patients that they're usually fit and well or young, or even if they don't have particular issues with the health, the advice will be just take care, loads of fluids, painkillers, decongestant if you're blocked, and rest for the first few days. If, of course, there is worsening symptoms or you're worried, especially shortness of breath, or, if you have any health issues that, you feel that things are getting worse rather than better, as it normally will be, then, of course, phone 111 or take an appointment in the flu clinic. But at the beginning, take care and simple measure, and the pharmacist will be able to advise on those simple things as well.